Welcome to the Caregiver Relief Podcast, where we shine a light on the challenges and solutions facing today's family caregivers. I'm your host, Diane Carbo, a registered nurse with over 50 years of experience helping families navigate the complexities of aging and caregiving. This episode is sponsored by myvitalvault.net, your all-in-one life organizer for aging adults and caregivers. It's designed to help you securely store your essential legal, medical, and emergency information in one easy-to-access place. Because when a crisis hits, being prepared can make all the difference. Join our Caregiver Relief community, a warm, welcoming space where you can connect with other caregivers, ask questions, share stories, and find support from people who truly understand. Visit community.caregiverrelief.com to join now, because caregiving is one of the hardest and most meaningful things you'll ever do, and no one should have to do it alone. And if this episode speaks to you, please take a moment to like, share, or comment. Every click helps us reach more caregivers who need encouragement, resources, and hope. Today, we're diving into a topic that's deeply personal and profoundly transformative: caring for a parent, healing yourself, EBT, emotional brain training for family caregivers. My guest is Dr. Laurel Mellon. She is a health psychologist and the founder of Emotional Brain Training, or EBT. She served as an associate professor of family and community medicine at the University of California, San Francisco for over 4 decades. She is a New York Times best-selling author of The Pathway and has written 12 books on EBT. Her work has been recognized by the American Medical Association as exemplary, and she has trained thousands of health professionals in the neuroscience of stress resilience, trauma, and chronic disease. Dr. Mellon knows firsthand the challenges of caregiving. She cared for her own father for 9 years after her mom passed away. Through EBT, she offers caregivers a science-based process to quickly move from stress overload to joy, often in just 5 to 10 minutes, by rewiring the brain's resilience pathways. If you've ever felt overwhelmed, burned out, or stuck in a cycle of stress while caring for someone you love, today's conversation could change everything. Dr. Mellon, thank you so much for joining us today. I'm really excited to share this information because it's going to ring true to so many of my family caregivers.
Diane, I'm so happy to be part of what you're doing here, because my heart goes out to anyone who is caretaking, because I've been there and I understand what happens in your body, what happens in your life when you're trying to take care of a loved one. And it's so challenging. And I just want to get this message out to as many people as possible.
I'm excited because caregiver stress is often called the silent health crisis. In fact, as I told you at the beginning, before we started the podcast, 63% of our family caregivers become seriously ill or die before the person they're caring for. So I'm really excited because from your research and experience, I want to know what makes it so uniquely damaging to our health, this caregiver stress that we have.
It's called love, really. The fact is, we will go further for that other person than we go for ourselves. And when we go really far for them, tolerating the intolerable, just the amount of physical work sometimes, the emotional pain, and also just not knowing what can we do and how are we falling short and when is too much. It's just extremely difficult because of the bonds of love. We are mammals. And what mammals do is mammals take care of each other. And as a consequence, it's much harder to find that boundary. If someone is a professional care provider, they stop and they don't do as much. And yet, just biologically, genetically, we are programmed to overgive to those that we most love. And so it becomes much harder for us as well. These relationships that we have, I had with my father, My mother died in 2007. I took care of my father until 2016 when he passed away. But I went to all sorts of extremes in that because of shame, of guilt, of feeling I'm not enough, of he would call and my whole body would, when he would need more, and my whole body would feel that stress. And then what happens is our whole relationship with this person is relived in our caretaking. Some of the frustrations and angers and disappointments we have in that person, as well as some of the blessed moments of rapture. So he's just firmly packed with so much energy and conflict that we oftentimes overgive and then we pay for it. I will tell you that in all my years at the University of California, San Francisco, in developing EBT and developing the app that actually switches off that stress response, what I learned was that caretakers are identified as the most stressful role that anyone can take. In fact, the studies that were done on psychological stress to prove that people who are caretakers will die earlier and will have more health problems was done on this population because it's recognized as the hardest thing any human can do.
And it's definitely a challenge for everybody involved. In fact, you say that caregiving stress often stirs up those not just present day challenges, but old emotional wires from our past. And I see that constantly where you could have lived away from home for 20 years, 30 years, and you're coming home or going to help out with the caregiving of your loved one, an elderly parent or family member. And all of a sudden, those old roles we played when we were young in the family dynamic start over again. That is so challenging. And so many family caregivers do it alone, and they have uninvolved siblings and uninvolved extended family members who are judgmental and dismissive and sometimes abusive to the person who's providing that care. And it's very frustrating. So for those who are new to it, what exactly is emotional brain training and how does it work? And tell us about your app and how that works with this.
Well, wonderful. The idea is most people are used to thinking about their stress or their emotional states based on thoughts, emotions, and behaviors. And in about the year 2000, there was enough evidence to show that was ridiculous. Most therapists are not certified in EBT. That's why we're aggressively trying to reach any therapist we can and train them in EBT, because it's almost like being in the pre-computer age and then having the internet. Because in the pre-computer age, you'd go to your library and you'd go to an encyclopedia and you'd look things up. And then the internet comes and all of a sudden you say, it's completely different. It's on the screen and I can learn anything. When you've been working with changing thoughts, behaviors, and emotions, that is not the way the brain works. The brain works, first of all, it's not the neocortex, the thinking brain, that's a problem. We know what we should do. We know we're very rational in the rest of our lives. But it's in the emotional brain, the unconscious mind, that actually encodes circuits early in life, like our roles, like I was the caretaker, I was the good girl, I was the reliable one. And also, it encodes all of the emotional clutter, all of the disappointments, the trauma memories, all that. But it also packages them very conveniently into what's called circuits. And we have two kinds of circuits in our brain. It's incredibly simple. If we're running the good kind of circuit, it's called homeostatic or health promoting. It's called a joy circuit, because when you're in that state, you do hard things, and afterwards you feel this glow in your body because your chemicals are at their best. You're fine. But that's not what happens to caretakers. Somehow you cross the line and there's too much stress, and you have the other kind of circuit that's called a stress circuit. The stress circuit is a whole different animal. What it does is once it gets triggered, it gets stuck on. And it takes you way high. Everything's fine when it's not. It takes you to numbness where you have no feelings anyway, or it plummets you down to a big low. But either way, you're disconnected from your actual accurate emotions in the moment. And your biochemistry is completely dysregulated. Because these circuits get stuck on, it means that's why we have mental health problems and chronic diseases and premature death and accelerated aging. Okay? So the problem is no longer, oh, I have a diagnosis, or I have bad thoughts, or my behaviors are bad, because the circuits include emotions, thoughts, and behaviors all in one big swoop. And so if you clear your stress circuits, you're going to get back to that positive state, that healthy state, that joy state naturally. What's been missing in the medical framework is a way to activate those stress circuits, because they get activated without our permission, right? We're going along, we're doing fine, and all of a sudden we're numb, or we're really low, or we've completely crossed that boundary and done so much for someone that we have resentments and hatreds, and we're sick, and then we have stomach aches, and we just can't do it anymore. What these tools do is they essentially erase the stress circuits and encode the joy circuits. In order to do that, you can't think your way to erasing those circuits because they're emotional wires. You have to process emotions in about 2 minutes. And when you process emotions with a burst of a protest against feeling bad, and then sadness, fear, and guilt, it unlocks that circuit. And this is the really amazing thing. This is why I believe in the spiritual nature of our brains. Because when you feel bad and you get out the app, you complain to the app about 5 sentences about what's going on. And then you say, what I'm really stressed about is, and you say a couple of words, he's too demanding, or I can't take it anymore. Just something really simple. Your brain finds and unlocks and readies for erasure the precise circuit in your brain that is amplifying your stress. The precise one. You can't even do that with a brain scan. There's no brain scan that will do it. There's no medication that will do it. If you complain, and instead of thinking your way through it, get out the app, drop into your feelings, which you've experienced in your body, and protest it with a little bit of anger, sadness, fear, guilt. The brain opens up like a flower, and it tells you exactly the false belief, like I have to be perfect, or the false expectation, like I get my survival from draining every ounce of energy out of my body to the point that I am miserable from helping this person from all pain. And it raises that up to your conscious level. And once you know what your unconscious mind is telling you, because the unconscious mind is the boss, it is definitely what determines what we do, not our conscious mind. You can flip it over to something positive, and boom, you weaken the circuit and you shut it off, and you are in joy. It's that straightforward.
That's exciting to me and interesting. I know we caregivers out there try everything. We try stress management or mindfulness approaches. So you have a different way of handling things through your EBT app. How is that different from what we normally do? The first thing I do is take a deep breath and go, slow down, think.
And if you're not very stressed, that's enough.
Yeah.
There's 5 levels of stress in the brain. There's level 1 is joy, and that's the lowest stress. The thinking brain's in charge. 2, the thinking brain is still in charge. You don't feel quite as good. You feel good. You're running those joy circuits there, so you're okay. And that's the illusion, is when you use mindfulness or positive thinking or deep breathing, it will help you if you're not that bad off.
Yeah.
If you're only just a little bit stressed. Once you cross that line in your brain, which is about where your cheekbone is, the brain will put a lower, more extreme area of the brain, more primitive area in the brain, in charge when you have higher stress levels. And these circuits are the stress circuits, totally different animals. They disconnect you, so the thinking doesn't work anymore. The mindfulness is out the window. The deep breathing is nothing compared to what's going on. And then they activate these incredibly nasty circuits that are with stuck emotions and toxic emotions that start flowing. It's biochemical. It's not just psychological. So you have these fight or flight stresses going on, chemicals going on, and all the memories from times when you were stressed before, when you weren't thinking that well, appear real. So you are not able to find your best self. It's not you, it's not me, it's everyone in that state. And that's 3, feeling a little stressed, 4, definitely stressed, and then the reptilian brain takes charge at 5, and then we're just blotto. We are sure there's no hope. There's never a tomorrow. No matter what I do, it won't work out. This will never end. And that's where all of we're being self-abusive and we don't even know it. It is amplified by the circuits. What you do when you're in the 3, 4, 5 is you reach for your EBT app and you understand that thinking is not going to solve the problem. Thoughts don't get through to these circuits. Being aware is like spitting in the wind. You need to take the toxic emotions in those circuits and unravel them. And just by using this tool to protest with an anger, sadness, fear, and guilt for really like a minute or 2, something like that, what happens is that circuit gets shut down. And then that joy circuit or that resilience circuit takes over. And before you know it, you're back to brain state 1, where your chemicals have stopped harming you, stopped creating mental health problems and chronic diseases, and that there is a light at the end of the tunnel, and you really take care of yourself as well as the other individual.
So that's your spiraling up to joy that you talk about that occurs in just minutes.
Yes. And what's so important is most health professionals don't even know this. This was developed at the University of California, San Francisco, the epicenter for stress resilience and neuroplasticity, but it goes against everything that therapists tell us to do. They tell us to be aware of our feelings. If you're at brain state 1 or 2, running those resilient joy circuits, fine. Once you cross that line, and everyone who's caretaker has long since crossed that line, asking yourself how you feel. She said, what do you mean how I feel? I'm overwhelmed. I'm lost. I'm confused. I feel furious. I don't know what I'm going to do. I'm hopeless. I'm depressed. Well, that doesn't really help you at all.
Nope.
So in other words, we're rewriting the rule book on psychotherapy, and we're also rewriting the rule book on medicine, because although it's important to take the medicines you need for whatever the health problem is, heart disease, cancer, whatever that is, because those conditions increase your stress.
Yes.
But the fact of the matter is the root cause of it all are the stress circuits in your brain. And what we're trying to support for all health professionals, if you're going to give medications, you're going to give them a dose of EBT too, to get rid of the stress circuits that are actually making them sick. If you're going to go to a therapist, you can talk your way around the street, but until they rewire the circuits that are causing those mental health problems, they're not going to really get alleviation. And also, it shouldn't be about the doctor or the therapist. It should be about us, because these are tools that anyone can learn. Anyone can reach for the app. And when you reach for the app, you get a biochemical change on the spot. Everyone needs to know that.
Wow. Can you talk us through a real life example of how a family caregiver might use EBT tools in the middle of a stressful moment?
A special moment. Let me share some of mine.
Okay, thank you.
Okay. I loved my father, and I was also a single parent raising 3 children, worked full-time at the university, and was doing research and development on EBT. So I was a busy individual. And my father had all sorts of problems. He had a heart attack, he had dementia, he had terrible nausea. And he also got he was a little bit of a hypochondriac. He was always finding something wrong. So we were always going to the hospital, and we were always going to the doctor, and his nausea would come up, and he would just sit there, and he'd just look forlorn. And so I'm always going up there to where he is. He had a place he took care of but my brother and I were going up almost every day, and he was just beloved to both of us.
Yes.
And one day I was going in, and it was after I'd just seen a whole bunch of patients. I was exhausted. I walked in, I was about to walk into his room, and I knew I was not running joy circuits.
Yes.
Okay?
Yes.
And I thought, I'm not going to do that. I'm not going to go in there and I have a false happiness on my face and fake it. Because what do we all really need but honesty and authenticity and intimacy? So I reached for my app and I spiraled up to joy. And I was really proud of myself, because my reward was I wanted to have an authentic relationship with my father. And I walked into the room feeling whole instead of fake.
Oh, that's
And
beautiful.
so I listened to him, and I also told him about some of the things going on with me, which showed him respect.
Yes.
There was an intimate connection there, so I didn't fake it. That's one. I'll tell you a worse one. You want to hear a worse one? It gets really bad. And for those of your listeners who are having a hard time, believe me, what happens is it piles up. And on good days, you're okay. But on the bad days, you can hit a real low.
Yes.
And I remember going up to take care of my father. It seemed like the 1,000th time that week. And I came home and I actually hated him. And I felt hatred toward him. I hated him because he was so needy, so dependent, so demanding. And I knew I was at brain state 5, that I truly loved my father, but my stress level was at such a high that the fight or flight chemicals were
Yep.
causing the extreme emotions. Now, I could have gone numb, or I could have gone to a false high. Oh, that's okay. But my brain that day was going to an extreme low. And I really felt threatened because it's important to know that psychological stress in the human brain is treated like physical stress. So when you're feeling attacked psychologically and you say, why can't I get over that? Oh, it's not so bad. It's not about you psychologically. It's about you biochemically. And what's happening in your brain is that your brain is telling you you're being eaten alive by a lion. And it is spurting out all of those stress chemicals because it's telling you're going to die. And when you're going to die, if you were up against, let's say, a lion who was coming at you, you wouldn't say, that's okay, don't worry about it. Biologically, we are programmed to protest with strong negative emotions.
Yeah.
And so what I allowed myself to do is use one of the tools in EBT, which is called damage control tool. And I love damage
that
control
name.
tool. Yeah. And so I would repeat it to myself. And first of all, I allowed myself to be angry, knowing that I was at brain state 5 and I needed to express my anger and I need to cry.
Yeah.
And what happens is the willingness to be open to really socially unacceptable emotions comes from knowing how the brain works. And then I used damage control, and I actually brought myself up to a spiritual high where I felt in love with life. I loved my father, and I also loved myself enough to give myself a break.
That's fascinating to me. Now, you recommend caregivers join a spiral up group.
Right.
What happens in those groups, and why is that peer connection so important?
First of all, everyone needs the app. If you can afford nothing else but the app, get the app.
Yeah.
But there's also upgrades to be in community. And the reason for that is that the emotional brain is a social brain. And when we get with other people using these tools, the depth of the effect on us escalates, but also that we are not alone. And with EBT, we've set up the ebt.org website, is also called ebtconnect.net website, with all sorts of choices, but everyone who moves just beyond having the app to have the social support, every single day of the year, there's a group there.
Yep.
And you just call in anonymously to the group, and there'll be this wonderful EBT provider who greets you and says, hello, welcome. And then one person will say, she says, I need a volunteer to spiral up. And someone will volunteer, and then she'll guide them through the whole EBT process of spiraling up, but much more deeply, help teach other people how to actually do this. And what happens is that person goes from being very stressed all the way up to joy. And because the thinking brain has no walls, even if you come into the session feeling at brain state 5, like you're totally overwhelmed, their energy goes into your emotional brain, activates your joy circuits. And by the time you leave a half an hour later, you're in joy and you don't even know why. Because we're all connected. And the process of going from stress to joy is the same for all individuals. So it's very catching. And also, if you get into a private group, then you have 7 other people that you can connect with throughout the week. And it's different. If you have a friend, you're going to talk to your friend, and at some point your friend's going to get really tired of listening. And
Yes.
also you're going to probably talk on and say, what did I say? And should I have really said that?
Yeah.
With EBT, the calls are limited to 5, no more than 10 minutes. And when you call someone in your group, a buddy in your group, it goes through, nobody knows each other's last names or their phone numbers, is all protected, so it's very private. And it could be someone from Alaska or someone from Connecticut or wherever. You know their first name, but you become bosom buddies with them in your group because you've connected with each other over time. Most people stay about a year in the method. And what happens is one person says, do you have time to connect? And the person says yes or no. And if they have time, then they say, who do you want to spiral up or do you want me to? They decide. And then one person spirals up using the tools, the other one listens. Both people end up in joy. They don't even remember that they have problems, and they're closer in their connection with each other. So our research has shown that these connections really help people deepen their work with EBT and become really a lifeline. And it's different than having AI companion where they just mouth back to you what they have said. I said, oh, you have no reason to feel that way. You should feel good about yourself. It's so vacuous.
Yes.
For real people where you deepen your relationship with someone and you both bring each other up and you both learn from each other.
Yes. Yes. Now, for caregivers dealing with grief, guilt, or even resentment, how can EBT help them through the process with those emotions without shame? Because that's a big one. Caregivers have a hard time forgiving themselves. They're hard on themselves. And they so often feel shame if they ask for support or help from anybody, or they feel judged.
Great. There's 2 ways. First of all, you can get relief right now because I'm going to tell you something really important. And secondly, the tools themselves are set up to prevent shame and to promote empowerment. So the first is that when you have one of these circuits come up that makes you feel bad, there should be no shame because the circuits in your brain that are stress circuits, because clearly if you were not taking care of that person that was a relative, you probably wouldn't push yourself so far, and you probably wouldn't get to the point that you're really abusing or neglecting yourself.
Yes.
So the reason that you're going so far or even feeling that shame is the programming in the stress circuits from early in life. Okay, those beliefs, like mine was, I have to be perfect. I have to keep everyone happy. I have to be the good girl. I have to rescue everyone. So all of those circuits are not conscious. You can think about them, but the drivers to actually act based on them are in the circuits, and the circuits have to be erased. So they were put into my brain and your brain without our conscious awareness. So the fact that we have the circuits that make us feel so bad is not our fault because they happen during times of stress when the thinking brain's offline and the emotional brain just, whatever we experience, it stores without review. So really stupid things, like I have to be perfect, are stored there. And then we believe them as if they were the Bible. You know, this is just the Holy Grail right there.
Yes.
Okay, so anything that you're doing that makes you feel bad or that you did do, let's say you struck the person, or let's say that you had negative feelings toward them, like I was having hatred toward my father, or let's say you neglected them at times.
Yes.
That's coming because you have circuits in your brain that make you overgive.
Mm-hmm.
And when you overgive, the price you pay is the brain never forgets it, and it lashes back in ineffective ways that you later really regret what you said. So the circuits that make you overgive and then have a backlash of behaving in ways that you wish you had not are in your unconscious mind. They were put there through no fault of your own, so there is no shame. We act based on our circuits. And who told you that you could rewire your circuits until you're listening to me now? Because the technology and the science hadn't been developed until 10 years. Secondly, the circuit, the tool you use, the major tool you'll use, we call it spiraling up in EBT. It's called the cycle tool. Built into it is prevention of shame. And I'm going to tell you the formula right now.
Wow, that's amazing.
The difference between shame and guilt is huge.
Yes.
Shame is I'm a bad person.
Yes.
Now, on that day that I still remember where I was on my bed, I was just saying, I hate my father, I hate my father, I hate my father, and then being rageful and then crying.
Yep.
That I did not shame myself because I'm an EBTer.
Yeah.
I didn't shame myself. But I have a friend, a dear friend, a friend that is one of the nicest people I've ever met. I can't tell you what a wonderful human being she is. And she took care, she lives in a trailer, and she is a single person, has 2 dogs, and she lived with her mother, taking care of her mother for 14 years. Her mother was very small, very demanding. The sisters were always criticizing what she was doing, but she was giving up her life for this. She had to change her diapers. She had to, on and on it went. And toward the end of her mother's life, there were a couple things that my friend did that she regrets that were, to me, thinking very minor. But for her, she's haunted by it.
Yes.
Because she's shaming herself.
Yeah.
She's saying, I'm a bad person.
Yep.
So all she needs to do, and she has to do it a number of times. It doesn't happen just once because she has to retrain her brain out of shame.
Exactly.
But the basic formula in EBT is to complain, which mom told us not to do.
Yes.
Because that activates the circuit that's making us overstressed and shaming ourselves. But the first of the 4 feelings, angry, sad, afraid, and guilty, and the protest, why am I doing this or whatever? 1 sadness, 1 fear, 1 guilt. We encourage you to be angry at the person. Just get it out. I feel angry. When I'm putting myself in my friend's position, I'm angry that all she does is want and never stop. And I feel angry that I hated that. You just get it out. Okay? And then what happens is just 1 sentence, I feel sad that happened. I feel afraid that it really hurt her. But the other really major feeling is guilt, because guilt is power. And so I asked my friend, I said, as you look back on it now with that thing you did that you regret, what was your part of it? What would you do differently? I feel guilty that I didn't ask for more help or whatever that would be. I feel guilty that I don't appreciate how stressed I was. I feel guilty that I overgave to the point that my fight or flight drive was having a problem. So within that, by being able to be really angry, then you give yourself room to you stop the hostility, and you have room to get rid of shame and to just say, hey, everybody, my part of it was, and interestingly enough, our genes don't really free us from these memories of horrible things until we figure out what we contributed to it so that we can change. So the next time we're caretaking or the next time we're in that situation, we don't harm ourselves as much. We don't self-inflict these wounds.
I was a very young girl. I was 16, 17 years old, and my mom was diagnosed with lung cancer. And this is in the 60s, early 70s. And I took care of her. I was angry with her because she coughed so much. And I was the oldest of 4. My dad couldn't deal with it. And I was shamed into taking care of her, even though I was so young and didn't know what I was doing. So when you say what you're telling me, it really resonates with me. My mom had a thoracotomy, which is an incision into her thorax for my listeners out there, and gallons of fluid would come from her lungs. And I can remember just being so tired. And I've carried this guilt and shame with me my entire life. Here I am, 72 years old, and I'm still feeling the trauma of being a caregiver at such an early age, the helplessness. And I loved my mom. Oh, Lord, I loved my mom. The expectations for me to provide care for her, the coughing, every time she coughed, I just felt stressed. So I wished I had known about this then.
Yeah.
Because it's impacted my whole life.
Okay, I have some things I can help you with right now.
Oh.
Get on EBT.org, get a membership. And the 2 major skills you would learn. And one of them is you just have to unpack the suppressed emotions.
Yes.
And because of the emotions, if they're not unpacked effectively as they are with EBT, they get stuck there and cause health problems and cause ruminating and always thinking about it. And cause you to feel like you're sitting on dynamite and you never can quite get off of it.
Yes.
And they have to, and it's called the instant boost. And with that tool, you go onto the app and you press number 1 and you move through angry, sad, afraid, guilty, and then it moves to grateful, happy, secure, proud. You express those 8 feelings over and over again. You might have to do 100 of those. Because you pack, but it takes literally 2 minutes.
Okay.
Unpack all that. The other is is there any shame left or regrets? Do you have any shame or regrets?
You know what? I do have shame. I do have regrets. My mom was told she beat lung cancer, and I was just a freshman in nursing school. She was on her way to tell me she beat cancer. We're going to have a great Christmas. And on the elevator on the way down, she threw a pulmonary embolism and went to intensive care and died that evening. There is so many complex emotions that have impacted me my entire life.
Exactly.
That I've always been a caretaker, caregiver, but I can tell you right now, I honestly keep many people at bay because I don't want anybody to expect more from me than I'm able to give.
Okay, so there's 2 ideas there, and all of this is in basic EBT training. It takes about 3 months to get the basics down, and then after that, you continue to raise your set point or the habit of your brain. But one thing is that at the time, if you have any regrets about what you did in any occasion in the caretaking process with your mother, appreciate that the circuits that you have in your brain now are different than the ones you had back then.
Yes.
And for all of us, just biologically, we want to be there for the good. And so for the circuits you had at that young age, the best you could, and there is no room for shame. Okay. And secondly, once you've cleared, we first talked about clearing the situational stress, and now the circuits that are getting in the way that could still be there, the shame or of boundaries and such. The other is there's certain life skills that you learn in EBT to set boundaries. So you would learn the skill so that you would rewire your distancing circuit without strengthening your merge circuit. So in stress, we either get overly close and lose ourselves because the brain can only focus on how other people feel and what they need.
Yes.
Or the brain gets stuck and just wanting to know how we feel and what we need, which is cause distancing. This is true for all humans. It's all healthy humans. When we're at brain state 4 or 5, we'll either merge and lose ourselves or distance and lose relationship. Okay. So you would rewire your merging circuit. There's part of you that may be left over still having unmet needs for loving connection, where you may be overly giving to people.
That is me.
The distancing. So the distance and merging circuit, you can get rid of those in the first few months of EBT. And then you will also learn how to actually make an effective request that's based on brain science. So when someone asks something of you, you pause and say, I'll get back to you. You go use your EBT app and you get to brain state 1. It's only in brain state 1 that you can really see your true feelings and needs and have room to consider another person's feelings and needs and come out of it with intimacy, not with overgiving or undergiving. So you get to that clarity state.
Wow.
And then you do something called an EBT sandwich. It's a technique. It really should be licensed because it's a technique where you actually make a request that people can never refuse, because you first give them empathy and how you feel and what you need. You make your request and you give them more empathy. And what happens is when you do that, you not only create boundaries and make effective requests, but you get more of your needs met and the relationship is more intimate.
I love that, because one of the biggest problems most caregivers have is setting boundaries and knowing their limitations. Guilty of that in the past as well. I just am. I know. I did it with my mom. I did it with my dad. I did it with my son that I cared for. So yes, I understand that. So I'm going to absolutely sign up for this. I definitely want to learn about it because I think I'm stuck. At 72 years old, I'm still stuck, Dr. Laurel.
And that's all of us, because we have this society that is telling us that we're all about our thinking brain. And if we just thought positive thoughts and boy, if we ticked off what we did on our list of to do, everything would be fine. It's malarkey, because the circuits in our emotional brain, the stress circuits that were encoded through no fault of our own, rule us. And we can't find that sweet spot of connection until we clear the circuit. So what you're going to do going forward, and welcome to the EBT community, is that when you hit a situation that's difficult, you stop and you ask yourself, am I in joy? Am I at brain state 1? And if you're not clear that you are, you say, yeah, and I'll get back to you. You go to your EBT app, you get to joy, where you have clarity, where you make all your wise decisions, and you go at that point and not until. So if you're not at brain state 1, remember 1 is the joy state, all the way down to where your thinking brain really is clear and in charge and all your wise memories are activated, all the way down to 5. You just pause and give them some kind of an answer so you don't have to say anything. You get to 1 and you will be really surprised at how wise you are, because we're controlled by the stress circuits. And when they get turned off and our resiliency joy circuits turn on, it's no problem. It's so clear to us. And we set those boundaries that keep us healthy and also maintain the relationship, like with my father, maintaining the relationship with him that was respectful and dignified, where I didn't feel like, frankly, I'd been dragged through the streets. And otherwise I would be, because it's just hard to set boundaries and no limits when your brain is in stress overload. It just can't happen, even to the wisest person. We're ruled by our stress chemicals, and that's what we can switch off with the EBT app.
I can see using this 100 times a day, especially as a caregiver. My son was a veteran, or actually he was in active military when he developed a severe pain condition, and he had 8 years. He had a suicide attempt in the VA hospital, Madigan Army Medical Center. This was 16 years ago. And then 8 years later, he successfully committed suicide. And it just was overwhelming. And I have so much sadness and grief and anger at him for not reaching out to me more, not leaning on me more. And I can see that this could have made him and myself a different person.
Absolutely. But you can be a different person now.
Oh, so yes.
You can be a different person now. And his life, if we could get EBT into the military, and I'm doing podcasts for the military for that reason, because they are suffering. And they are suffering so badly. And they're teaching them things like deep breathing and mindfulness that we know from science do not get into the stress circuits. They just keep you in limbo. And so we want people to get to the root cause. These stress circuits are vile creatures, and they make us have suicide ideation or even act on that. And they make us shame ourselves, and they make us stay in limbo like we can never really resolve it. I did something really bad in my life, which I won't go into, but there's something I did in my life that I really regret. And it was when I was at brain state 5 and I was in a lot of stress and I made a mistake. And for years after that, I thought, I'm never going to recover from this. I'm never going to feel like a whole person because I did that. I can't believe I did that. And my life is ruined.
Yes.
And then I applied EBT to it. Because remember, I'm 76 now, and I was maybe 30 at the time. A long time ago, I didn't have EBT. And I just went back, and this is what I really recommend, is what you do is appreciate that when you have a memory of something happening, you're actually activating the circuit of that time.
Yes.
It's real. It is not like a psychological thing. You're actually activating a neural circuit from that experience. And so what you do is you heal yourself. And what I did, and I did this a number of times, and I probably did hundreds of cycles on it, but I reached peace. And the way that you do that is you appreciate that We all act in certain ways based on whatever circuit is activated at the time. And so I go back and just tell the story, write it out, tell the story. At this age, I was doing this, and then this happened, and you hit something that you really regret, right? And instead of going into the stratosphere of shame and blame, you then process your emotions back to coherence and sensibility with EBT.
Wow.
You will at that point appreciate that for who you were in that moment, you actually relive the moment as you were at that time, and you realize, given your circuit, that was the best you could do.
Mm-hmm.
And you also find if the circuit that made you do it still in your brain, find that circuit and you erase it. And you know that you will never behave that way again. Okay? And as you march through, because there might be 2 or 3 or more things where you regret, each time you pay the price. You have to take your emotions that are toxic and spiral up so that the feelings are health promoting. You unlock the brain and you find out what was your unreasonable expectation that was in that circuit that made it perfectly reasonable to behave the way you did. And then not only do you find that circuit, but you crush the circuit, you destroy the circuit, you obliterate the circuit until it's gone. And you know in your heart that if this thing happened today, there is no way on earth you would do what you did before. And it's only when you've found the circuits and erased them that you can be at peace.
That's fascinating. I haven't been at peace or comfortable since my mom died. And then it's all just accumulative after caring for so many other people. So I find this fascinating. I just really do. Now, you've been teaching this method for over 40 years.
Yeah.
Damn, I wished I knew this.
No, in all honesty, I was a young person at age 28 when I discovered that cognitive and behavioral methods were bogus. And I went back in the literature, and this little lady from psychiatrist from Baylor College of Medicine in Baylor had discovered that what was going on with children that were distressed was lack of emotional connection. And as a young 28-year-old new faculty member said, not a problem. I think I'm going to develop tools of emotional connection. And that's because I was not a problem. And so because I was in a university where it was one of the top research universities in the world, you always have to do research. And so we did the research and it showed, oh my gosh, it worked. But mainly what influenced me was one person. A mother of one of these kids that was so distressed came to me and said, what did you do to my daughter? She used to be so depressed and she was using food and whatever. She said, now she just goes outside and wants to play. She's a different person. And by the way, I want what she has. And at that moment, I was a young woman. I had one baby that died when I was 23, but I was told I couldn't have children. And that's why I went back into school. But I ended up having 3 more children after that who ended up being healthy. What I knew is that I would be a bad person if we discovered something that important and I didn't follow it. But it would take me 25 more years before the science that informed us why it was working would come out. And then I had involved in it neuroscientists and neurophysiologists that helped me move it to this level. So it's been definitely a community effort over time. And it wasn't really till the last 10 years that the app began to be magical, where we could see that we could rewire trauma, we could rewire little things that were going on, we had medium things, and then the trauma things we could do. And it was all universal and could be put into something as simple as an app.
With the mental health situation in our country right now after COVID, I can just see this is amazing. And every high school and grade school should be teaching this from what I see and hear, because we really have a public health crisis in our country right now, probably all over the world because of COVID. And it's negatively impacted our youth so much. I'm hearing so many sad things about our youth. But then again, it's the caregivers. That's my challenge, is my family caregivers, because they need so much help and they don't know where to get it and what to do and find something that works for them. Now, you've got this method for over 40 years. It's evolved. What excites you most about its future?
Oh, the future is that I really believe it was a spiritual gift. I don't think I put this together because every time I hit a wall, which there's been many walls and much rejection, because anytime you have something that's a new paradigm, everybody's scared of it.
Yes. Yeah.
And I believe that just I had incidents that were so scary that felt heaven sent. I'll tell you an example about my father is that he had passed away by that time, and I had given some national conferences to social workers on EBT, and the ratings were exceptional. So they invited me back for a big talk. And during the middle of the night before the big talk, it was going to be on Zoom. It was during COVID. I woke up in the middle of the night and I heard this voice and I felt like there was wood around me or something weird. I was very uncomfortable. I don't normally wake up like that. And I heard this, I'm getting chills just saying it, this big voice, this big booming voice. It was my father's voice.
Mm-hmm.
And he said, "Do not quit."
Oh, wow.
And then I thought, that's crazy. Right now, I'm about to go to speak in the morning. When I wake up, I'm going to have to take a shower and get dressed, and I'm going to give a talk on Zoom to 800 people. And then I pause, and he says, "And be proud of yourself."
Oh, wow.
So I wake up the next morning all prepared, thinking, what was that about? I must have had too much popcorn last night or something like that. What's wrong with me? And I go to give the talk, and the woman comes into the room, and she says, "We have some bad news for you, because the accrediting agency for your work," and remember, this is coming from the University of California, San Francisco, is built on solid science, and our current methods are not built on solid science.
Yes.
They have decided to reject your continuing education credit. There won't be 100 people here. There will be 8 people here. And all I can think about is, now I know why I was visited there. But each step of the way, and I want you as a caretaker, if you're listening to this, understand that you are being guided. And all you really need to do is to, when you feel terrible, when you're at brain state 5, in that moment, you use the EBT tool that's called the transcendence tool. And in that moment, you open that tight fist of over-control. You release the over-control about getting what you want when you want it. And you say to the spiritual, however you define it, "Here to be of service." And when you make that shift from having it the way you want it, when you want it, opening your heart to the greater good, knowing you have to release over-control and tolerate not knowing, something magical happens in that moment. And then once that magic has occurred, all you do is you ask for help. And I recommend that you do what I do. You ask for the exact help you need. The exact help you need, because you're now functioning on a different plane. In the emotional brain is the seat of survival and disease and connection, and the seat of the soul. And when you say that, with either immediately, or within one day, you will get exactly what you need 100% of the time. So the overall idea is that EBT is so powerful because we as a society have been ignoring our emotional brain, which is the powerhouse of everything that matters. Once people get this app and start seeing that they can control the circuitry and the connection and the rewards and the meaningfulness of life by taking charge of their emotional brain with these admittedly simple tools, it's going to go like lightning.
That's amazing. I want to thank you so much for sharing this really valuable information, Dr. Mellon. Could you tell my listeners how they can find you?
The best way to find me is go to ebt.org. It's like food stamps, EBT, but it's a .org. And there are lots of books on EBT. I don't recommend them because I'd much rather have you start getting the app and get the app and get as much additional support memberships as you want, but just get that app and start using it. And what'll happen is you'll say, my gosh, what's going on? So I just really recommend one thing. Get the app. Go to ebt.org. It's also called ebtconnect.net. Also, please, all of your health professionals, go to them and say, are you certified in EBT? And if not, I'm using it. And it would be great if you got certified, because these health professionals are locked into their old way of thinking.
Yes.
And it's who's going to really make the difference with EBT? People demanding better.
Yes.
People
Yes.
saying it's about the emotional brain. There are
Yeah.
tools that are scientific and validated. Let's
Yeah.
start using them. And the therapists that we have who are trained in EBT are magical, and they love it for themselves as well as
Yes.
for their patients.
That's awesome. One of the things I love that you have an app, because the first thing a caregiver can train themselves to do is grab their phone with the app on it and just look at it, which is something that a lot of people, they can train themselves so they don't get overwhelmed and miss an opportunity to get to joy.
Exactly.
Up to joy.
What I think of it as is that I tell my patients, because I have telegroup, we have telephone groups, we'd have, it's all about loving support and community.
Yeah.
But what I say to you, if you're not in joy, if you're not at brain state 1, you need to exercise. You need to exercise your arm, and you need to reach for your app, put it in front of your face. Anything you do on that app is going to help you. And there's
Yes.
so many different ways to get to joy on that app. You are set. You are playing with a full deck of cards, and raise that brain state that you have. Clear those chemicals, and there's no looking back. So exercise your arm, reach for the app. In 2 or 3 minutes, 1 to 3 minutes, you will feel like a different person, because you will be. You'll be running a different circuit, and your biochemistry will be healthy and help you stay alive and stay giving and receiving love for longer.
Thank you so much. And to my family caregivers out there, you are the most important part of the caregiving equation. Without you, it all falls apart. So please practice self-care every day. Learn to be gentle with yourself. And I'm telling you right now, you better get the EBT apps because you're all worth it, and you have to realize you're worth it.